What is PID? What happens inside the female pelvis when an infection travels upward into the reproductive organs? This is pelvic inflammatory disease, or PID. PID is an infection and inflammation of the upper female reproductive tract. It can affect the uterus, fallopian tubes, ovaries, cervix, and surrounding tissues. PID often develops when bacteria move upward from the lower genital tract. Some common causes are sexually transmitted infections such as chlamydia and gonorrhea, although other bacteria can also be involved. One important thing to remember is that PID does not always cause obvious symptoms. Microscope. Let's look inside. Our first image shows a horizontal or axial cross-section of the pelvis. From this view, we can see the uterus in the center, with the fallopian tubes and ovaries on either side. We can also see nearby structures such as the bladder and intestines. When PID develops, the reproductive organs can become inflamed, swollen, and painful. Stethoscope. Fallopian tubes. The fallopian tubes connect the area around the ovaries to the uterus. During PID, these tubes can become swollen and inflamed. This is called salpingitis. Continued inflammation can cause scar tissue and adhesions. If the tubes become damaged or blocked, it can interfere with the normal movement of an egg and may affect fertility. Orange circle. Ovaries. PID can also involve the ovaries. Inflammation of the ovary is called oophorytis. In severe cases, infection can involve the tube and ovary together and form a tubo-ovarian abscess, which requires medical attention. Red circle. Uteruspid can also cause inflammation of the uterus and its lining, known as endometritis. Now let's look at the vertical, or sagittal, cross-section. From the side, we can clearly see the uterus, cervix, vagina, bladder, and rectum. This view shows how infection can move upward from the lower genital tract toward the upper reproductive organs. Symptoms, complications and treatment. As PID progresses, inflammation can cause swelling, irritation, and sometimes fluid or pus around the reproductive organs. The healing process can also create scar tissue and adhesions, which may cause long-term problems. Common symptoms. One of the most common symptoms is lower abdominal or pelvic pain. Other symptoms may include unusual vaginal discharge, fever or chills, pain during sex, pain or burning when urinating, abnormal or irregular bleeding. Some people may also experience nausea, vomiting, or fatigue. However, PID can sometimes cause few or no obvious symptoms. Why PID matters. Untreated PID can damage the reproductive organs. Damage to the fallopian tubes can increase the risk of infertility and ectopic pregnancy. PID can also cause chronic pelvic pain, and severe infections may lead to an abscess. This is why early diagnosis and treatment are so important.